Hello again, everyone. Mark Hackle, Macomb County Executive, Deputy John Paul Rea, one of our deputy executives, here to kind of give you an update what's going on here in Macomb County, and a little bit about what's going on with the COVID concerns or issues, and kind of update on what's happening. But many of you may recognize or kind of notice the attire change here, wearing a t-shirt over a nice white press shirt. Kind of says, you know, authentic, made me rich. Number 18 post. Why is JP not wearing one? He wouldn't take my advice.
I didn't.
He didn't take my advice.
I didn't.
So, authentic. I'm going to belabor this issue probably for the next year until the next Derby race.
There you go.
You're lucky, though. The Derby race was late this year.
It was.
So, next year's Derby race comes
It's going to be in spring, so
it
yeah.
won't be a full year. You got to listen to me talk
It won't.
about
I'm pretty looking forward to that.
You're very fortunate there. So, with that, on a serious note, talking about some of the issues that are going on here in Macomb County and kind of identifying the numbers. Just the other day, we kind of explained, because sometimes some of the people that are listening to what we're saying or trying to understand or take in the numbers and support that we're trying to give them on the numbers, there was a misrepresentation or understanding of, you know, the raw data here and what we talk about flattening the curve. This inverted bell curve is basically just raw data about the number of test cases. And as we kind of referred to here, this is the actual understanding of it more directly. We did more tests, and obviously those tests resulted in certain total positive tests, which showed that there's a low number of people testing positive, thus flattening the curve. And as you can see, the numbers dramatically decreasing, even when it comes to the death toll. So we're fortunate in that regard. But one of the things we want to kind of update people on too is some of the other indicators that are out there. Again, we opened, or I should say the governor opened up the gyms.
Yes, sir.
And I keep getting asked the questions, are you happy that they opened the gyms? It's not a matter of being happy that a business opens or not opens or whatever. Again, I think they are being very responsible, and we can support them if and when they do. But the question comes down to, what is it that we're using that supports it? What is it in the numbers, data, statistics, and science that is given that decision-making ability for the governor to say, here's when we're going to open it? Some people say just wait, and when she says so, that's when we're opening. But we're always hearing we're doing it based on numbers, data, and science, and yet we still don't know what that number was that allowed for this particular business to open up, or sector, if you will, that being the gyms. So we then tend to look at risk indicators to say, is this something that we're trying to follow? You know, whether it's the average deaths per day, which in Macomb obviously has been pretty low, significantly, and fortunately, we're glad to see that. But we know that the hospitals, as we keep mentioning, you know, are not inundated. They're recognizing they can handle us moving forward, and yet we're looking at the average daily count that we're seeing here. And in Macomb County, you know, the 7-day average cases per million population, 47, which is significantly lower than what we've had in the past. And
yes,
so,
sir.
In comparables to what we're seeing within the region itself, you know, we kind of fit right in there. So, a lot more testing being done here in Macomb County, with the help and support of our health department.
Mark, again, we've talked a lot about the whole notion of containment of the virus, and what we're seeing with the trends in the number is, again, some positive trends, not only bringing those numbers down as far as the 7-day average on cases per million, but also the whole notion on the test positivity rate. We've been under 6% now for about a week. That's a good trend that we're seeing, not only responding and managing it with our health department as they're working with our emergency management liaisons at the municipal level, but I think the other thing that's very important too is we're getting a heck of a lot more surgical with the engagement, whether it's reaching down to municipal leaders, providing additional resources, clarifying what's in some of those confusing elements of the executive order, what's the roles and responsibilities, how we relay this information to the appropriate state agency. That system, it's refined, it's responsive, and it's working for us now in the county.
And it is, and again, I can't help but go back to, if you look at just within the region itself, you know, everybody's very comparable, you know, where maybe one area may look like it's, you know, more glaringly a concern than another. The reality is we have flattened the curve. You know, I can't help but go back to the testing by the month. I mean, it's incredible the amount of testing we're doing, and that's really what at the onset the concern was. We didn't have the, I guess if you will, test kits. We didn't have facilities that were able to run those tests and come back with results, and we didn't have locations, but we were able to get that up and running in a very short period of time. And now people that want to test can get a test, and even those of you that are still sitting out there wondering whether or not you should, there are locations. Go to macombgov.org. You can click on the icon to get an understanding of where you can go ahead and get tested, and there's a lot of testing that's out there for free.
Mark, let's just look at the bookend columns here. When we started off in March, obviously this took everyone by surprise and storm. 2,000 tests. April, we're getting the system going, 20,000. Improvements every single month. We're August, 66,000 individuals tested alone here in the county. And again, The deaths is the big thing as far as the death rate. 601 back in April. 8. Every single death undoubtedly impacts a family, a friend, a loved one, a neighborhood here in this community. We're in tune to the data, we're analyzing it, and we're going to use it to refine our strategies day in, day out.
Yeah, and again, I think most people were supportive of even obviously the stay-at-home orders.
Yeah,
and trying to figure
absolutely.
out how do we shut down the economy, essential workers only. But then as we started seeing that the stay-at-home orders were lifted and sectors of the economy were open, the question became, what is the triggering mechanism to open various sectors? And that's been the frustration, trying to figure out what that data is and what those numbers. Is it something within here? Is it one of the risk indicator percentages? What might that be? But again, we still have not been getting a definitive answer on that. So I say that because right away after they opened the gyms, I was getting the questions from many people. What was it and how come we opened those gyms? I can't answer the question. I don't know what the risk indicator was. I don't know what the percentage was or the science and data. So now moving forward, you got theaters, bowling alleys, and some other, I guess if you will, businesses saying,
entertainment venues.
right, what do we do and how do I know? When am I going to? I can't answer the question. And again, that's a very difficult thing to put somebody in a position to, I guess, not be able to answer it when they elected you to say, how come you can't answer it? Not even our state representatives. I turned to them and asked them, do you have any idea what it's going to take for us to open up theaters and other entertainment venues? And we don't know. We got to wait for the press conference to say, now I think it's a good time.
Mark, I think the other interesting thing that you highlighted too is the continued coordination, outreach, engagement, clarification that we not only have from here in our Emergency Operations Center, as our health department works with the state health agencies and DHHS as we're working with our federal partners. That's a conversation that's going on daily. So the headline's going to read, there's a rift, or there's a question, or there's a pointed data point. No, what it is it's a continuous conversation, it's clarification, and the reason this conversation still keeps going, because of the 880,000 people that are in this county and the 18,000 businesses, those are the questions that we keep fielding.
Yeah, and we want better understanding.
Absolutely.
And, answers. I'm not one of those that just walks away from something. Somebody says, here's the information, just go and follow. I ask a lot of questions. So on that note, we're fortunate. Some of the schools have opened.
Yes.
We've had a great working relationship with them, and so far, so good. We're seeing that the ISD, along with those various school districts, whether it's obviously working remotely and at home, the kids doing their studies, or even in the school settings, I tell you, they're doing a really good job of making sure they're keeping those kids safe in those districts that are allowing the in-class learning.
Mark, we had a call yesterday with all the superintendents around the county, got an update of where they're at. The protocol is in place. Dr. Lokar and our health officers that were all on the call, getting back protocol procedures, what's happening in the buildings. Knock on wood, we had a great first couple days here, looking to close out the week strong, understanding should there be any challenges or difficulties or we need to step in, we're ready. We're ready, prepared, and the resources are at the table.
And anticipate that there may be an issue where somebody does test positive. We are ready to respond, and we're going to do that. We're going to be very upfront about it. But with that being said, we also know, going back to when you look at the testing, a lot of these test positives are not resulting in hospitalizations. A lot of these test positives are not resulting in deaths. And so with that, we are going to be able to monitor and, I guess, if you will, manage people that test positive by doing the contact tracing and trying to keep the environment as safe as possible by working with our school districts. So credit to the school districts to have made this difficult decision, along with the superintendents. A lot of input on behalf of parents, and again, I think within the communities to try to figure out what do they do. And there's varying degrees of feelings towards this, but most of the schools are open the way that people within those communities want them to be open. We're going to continue to fully engage.
Absolutely, Mark. Absolutely. It's going to be critical that parents have those options, because whether it's individuals that don't have, the opportunity to stay home and oversee a digital learning environment where they're going to need to use some form of preschool or child care. We're very fortunate in this county to have districts that have multiple pathways to serve wherever individuals are at and ensure that that's the safest environment for our children.
Yeah, and on another note, tomorrow is a very significant day for many of us. If we look back in history, to think about it, it was 19 years ago. 19 years ago tomorrow. Amazing. I was newly elected as a sheriff. In fact, January 1st, 2001 is when I first took office. And then September 11th, we had an incredible attack on our home soil here by some terrorists. And you know the story. Everyone does. And how challenging it was. But I got to tell you, looking back on that, and my memory serves me extremely well, as I got to imagine many of you who've lived through that, you know exactly where you were. Watching the TV. You knew what happened, hours after, days after. It was incredible how it united the country. I mean, it wasn't about the R's and D's. It wasn't about, divisive nature, cultural differences. We united as a country, and I got to tell you, I miss that because right now we see that there's a lot of divisiveness going on. And if for no other reason, maybe tomorrow, hopefully people will come together and just kind of like reunite for that moment in time and realizing, you know what, we are United States. Having been in law enforcement over the years, I truly support our fallen heroes that were challenged with dealing with that. Our first responders, police, fire, EMS, and even the dispatchers. And I got to tell you, that was the biggest component or concern back then was communications and lack thereof. And it was so tragic and so difficult. Here in Macomb County, we have created an infrastructure here with an 800 megahertz system that no one else compares to in the entire state. We have a Comtech center that we've been doing most of our updates from.
Yeah.
This Communications Technology Center, no one else has it in North America like we have here in Macomb County because it was the most critical component of dealing with the aftermath or the onset of this particular incident happening here in the United States. So tomorrow marks the 19th year, I guess, if you will, anniversary, and I don't even like to call it an anniversary, but from the date of that tragedy, and I don't think many of us have ever forgotten it, even though it was 19 years ago, it doesn't even seem like it was 19 years ago because it's so embedded in my memory. But you know what, for that moment in time, at least if not, tomorrow, can we please just unite and say, thank you to our first responders for the efforts that they put forth each and every day, because I do believe, overwhelming majority of them, are part of the solution and want to be supportive of what's going on in the public. And knowing that from having been a police officer for 30 years, we have some good public safety officials out there in the communities. There are challenges, yes, I agree. But in reality, these folks are and will continue to be part of the solution. And they do deserve this moment of respect, especially the ones that lost their lives in light of that challenging time.
Mark, it's a day of remembrance. It's a day of reflection. You bring up the whole notion as a newly elected sheriff. Myself, being in my freshman year of college, I remember leaving my math class and walking into the dorm and just seeing a huddled amount of my classmates around a TV trying to figure out what the heck's going on. How that moment in time has impacted our lives 20 years later is just something that will be a continual remembrance of what happened and how we've responded and met those challenges moving forward. Whether it's continually making public safety a priority here in Macomb County, the investments that we've made to support our first responders and ensuring that we're always vigilant in protecting those, that protect us. These are things that you've continually talked about day in, day out, and things that we will continue to not only bring to the table and inform the public via macombgov.org.
And if you're interested, tomorrow at 40 North Main, right in front of the courthouse over here in Mount Clemens, 7 p.m., they're going to do if you will, kind of a vigil, an honorary remembrance of those that lost their lives as a result of that tragic day, and honoring our fallen heroes. Here as public safety officials, one of the keynote speakers is Sheriff Wickersham. He will be there as well. Obviously, his background in law enforcement, he was a captain working for me the day this incident happened 19 years ago. So with that being said, if you got time, 7 p.m. tomorrow, in front of the county building, there will be a short vigil, remembrance of what happened during those tragic hours here in our country. So again, thank those that are public safety officials that are out there doing the work day in and day out, 24/7. But we also want to remind you to continue to keep you and your family safe.